Welcome to this channel, and we have to discuss about for today's lesson in about for the course of heart failure and how to manage and how to treat and how to diagnose this patient and how to prevent for the future. We have to discuss. So you have to enter and to learn with me. So what is the meaning of heart failure and what is the cause of etiology and how to the clinical presentation and anatomy and the physiology risk factors. We have to discuss more in this way. So we have to follow and subscribe for the future to get more information. So uh, uh, the introduction to heart failure, so definition and overview, epidemiology, global heat burden. We have to see for in the future and pathophysiology basics like systolic versus diastolic dysfunction and classification like left end versus right and acute versus chronic and heart failure uh, and ejection fraction. We have to discuss reserved and so in the anatomy like we have to discuss cardiac cycle overview, role of preload afterload contractility, neurohormonal regulation, RAS, central nervous system, and then natriuretic peptidase and then myocardial remodeling we have to be seen. And etiology and risk factors like ischemic heart failure disease, hypertension, valvular heart disease, cardiomyopathy, like dilated hypertrophic restrictive we have seen in the future. Yeah. So arrhythmias is other cases like alcohol drug, thyroid disease and infections we have to see. Other causes like this, so in the pathophysiology, in dips like forward versus backward failure, systolic versus diastolic, composite mechanism and their consequence, cardiac remodeling have seen in the future. So uh, we have to get this information. So please uh, go together and the clinical presentation like symptoms, dyspnea, orthopnea, postnatural discharge or PND, and signs like elevated GVP, S3 gallop, hepatomegaly, pulmonary arrhythmias, acute versus chronic. We have to discuss. We have to discuss. So, and diagnosis like history and physical examination, laboratory tests like BNP, NAT, and troponin electrolytes like imaging, chest X-ray, ECG, gold standard for cardiac mRNA. We have seen in the classification and staging like NIA classification or NIA functions class 1 up to 4 and American College of Cardiac or American Heart Association A up to D and prognostic markers we have to see and pharmacological relief angiotensin converting enzyme inhibitor like angiotensin receptor blockers mortality benefit, we have to see beta blockers, aldosterone antagonist, SGLT2 inhibitors, vasodilator like hydralazine plus nitrates, digoxin, selected patients, acute management, drugs like IV diuretics, nootropics, vasodilator, we have to see, and non-pharmacologic managements like lifestyle modification, salt restriction, exercise, fluid balance, vaccination, patient education and self-monitoring, cardiac rehabilitation, we have seen. So, and the device in the surgical therapy like implantable cardio verter defibrillators or ICD, and cardiac resynchronization therapy or CRT, and left ventricular assist device or LVAD, and heart transplantation. We have seen. We have seen. And special situations like heart failure in pregnancy, pediatric heart failure, and heart failure with preserved ejection fraction and reserved, we have seen. So advanced heart failure and palliative care, and complications like arrhythmiasis, and thromboembolism, multi-organ dysfunction, renal, hepatic. We have we have seen in the future, and and outcomes. Prognosis and outcomes like risk stratification, survival rate, and quality of life predictors or pregnancy and like this. So case discussion and clinical proof we have seen. So based on this uh, so based on this type of disease, we have to how to approach and how to manage for this type of disease. Uh, the first thing, general principles for treatment, how to approach any disease, lifestyle, medical, surgical, supportive, and the second one is specific treatment for major diseases like hypertension, diabetes, and heart failure, and asthma, etc. And or the treatment framework like you can apply to all conditions step by step in system. So universal treatment framework that applies to almost all diseases, The first one is general approach to the treatment. General approach to the treatment. So uh, the first one is identify and remove the cause. So what is the cause of this type of disease and how to remove and how to manage to this type of causes. This is one of the most general approach to treatment of any disease. Like, for example, stop smoking in COPD, control blood pressure and heart failure, treat infection in sepsis, for example. And the second one is lifestyle modification. When any disease to treat and manage, the, it is the second stage or the first stage is lifestyle modification, like diet balance, slow salt, low sugar, healthy fats depending on disease, exercise, physical activity, weight control, avoidance of triggers like allergens and cold stress. The third one is pharmacological treatment based on the disease specific guidelines, antibiotics, antihypertensive, insulin, and bronchodilators based on the disease specific guidelines. And the fourth one is non-pharmacological supportive care, oxygen, fluids, pain management, psychotherapy, counseling, you know, based on this. The fifth is one is surgical and procedural treatment. When medical therapy fails or disease is advanced, so the treatment is more. It is the disease is more advanced that can be treated in the surgical way or procedural treatment. Example: uh, CABG ወይም CABG for ischemic heart disease, valve replacement in valvular disease and tumor removal in cancer. This is based on procedural treatment or surgical removal. Sixth, rehabilitation and prevention of recurrence. Cardiac rehabilitation, pulmonary rehabilitation, psychotherapy, and speech therapy, vaccination, prophylaxis, secondary prevention, and palliative and end-life of care for advanced and untreated disease, symptom relief, and quality of life focused. Examples of specific treatments, for example, in the heart failure. In the heart failure, we have to see how to manage and how to treat. Like lifestyle, in the first one is heart restriction, fluid balance, and exercise. The most lifestyle modification. And drugs like angiotensin converting enzyme, beta blockers, diuretics, and SGLT2 inhibitor, spironolactone, or an aldosterone antagonist, and devices ICD, CRT, and surgery, left ventricular transplant, heart transplant. More, this is the treatment of heart failure and hypertension, lifestyle, for example, weight loss, dash diet, exercise, drugs, thiazide diuretics like angiotensin converting enzyme inhibitors, ARBs, calcium channel blocker, beta blockers. This is more about how to manage like diabetes mellitus, for example. Lifestyle, the first one is diet control, exercise, weight loss, drugs like metformin, sulfonylureas, insulin, GLP-1 antagonist, complication management like eye, kidney, nerve, and heart protection, asthma, avoid triggers like allergies and smoking, relief, short-acting beta blockers, antagonists, peptic ulcer disease like lifestyle, avoid NSAIDs, alcohol, smoking, drug, proton pump inhibitor, histamine 2 blockers, antibiotics, H. pylori eradication. surgery rarely needed, complicated ulcer and perforation bleeding. So this is why up to how to manage the disease in general way now. So please to give more information about for the future, you have to subscribe and like to Agonist more advanced way to work with you.